The following special presentation of your Hometown Health Connection Community Conversations, Heal, Talk, Act, is presented by Buffalo Healthy Living Magazine with support from the Buffalo Federation of Neighborhood Centers, Karamia Pet Resort, Circuit Clinical, Endeavor Health Services, Medical Society of the County of Erie, the National Federation for Just Communities, People Incorporated, Community Services for Everyone, Horizon Health Services, Spectrum Health and Human Services, Best Self Behavioral Health, and WBBZ-TV.
Hello, I'm Sandy White with John DeShulo. Throughout the COVID-19 pandemic, Western New York and the nation saw an increase in opioid overdoses. According to the CDC, more than 93,000 people died from drug overdoses in 2020, reflecting a 29.4% increase from 2019. New York State Senator Pete Harckham, chairman of the Committee on Alcoholism and Substance Abuse and co-chair of the Senate Task Force on Opioids Addiction and Overdose Prevention, says the increase of opioid use is directly related to the isolation caused by the pandemic.
Calling loneliness and isolation the absolute worst thing for people in recovery or those struggling with substance use disorder and behavioral health issues, Senator Harckham says the increase in opioid overdoses in Western New York were a direct result of this. Now, in Erie County alone in 2021, there were 286 confirmed opioid-related deaths, with more than 100 pending, awaiting autopsy results. And so far in 2022, there have been 167 deaths, with 98 pending.
Joining us for this important community conversations are Ann Bowback, the project manager for Spectrum Health and Human Services Medication Assisted Treatment Program Enhancement Project, a credentialed alcohol and substance abuse counselor with a specialty in gambling addiction, and has worked in behavioral health for more than 30 years. And she is also project director for Substance Abuse and Mental Health Services grant in collaboration with Evergreen Health to reduce opioid overdose deaths in Erie County.
Emma Fabian is Associate Vice President of Harm Reduction at Evergreen Health, where she oversees harm reduction and drug user health services at Evergreen's sites in Buffalo and Jamestown. She also oversees the mobile syringe exchange unit that provides outreach in areas with minimal access to such services there in Chautauqua County and in areas of Niagara County, rural areas, and of course the east and west side of Buffalo.
Brandy Vandermark-Murray is Senior Vice President of Operations at Horizon Health, and she began her career with Horizon in 2006 as a substance use counselor and served in several clinical and operational outpatient and residential programs. She was instrumental in opening several treatment and recovery centers over the past 10 years, and she oversees Horizon's Oasis outpatient programs.
So, Sandy, I think you're going to start with Ann.
Yes, Ann, I'd like to know a little bit about a couple things here and start with you. There is clearly an ongoing situation here in Western New York. And according to the statistics, opioid use and the related deaths sadly continue. Why do you think this is happening, Ann, and what are some of the causes of addiction?
Well, there is not one specific cause of addiction, and you know, there's a lot of research continuing on what is the cause, but there's several things that make a person more vulnerable to having a substance use problem, and that would be things like stressful early life experiences, environment, if a person is heavily involved in an environment where drugs are being used, social circles where drugs are being used, a person with co-occurring mental health issues. Those are things that make a person some of the things that make a person more vulnerable to having a substance use problem. Why is this continuing to happen?
Right,
well,
why is it?
Yeah, I mean, as you said in the opening, COVID played a big role in continuing our overdose numbers in Erie County and increasing them. Isolation, obviously, and the stress associated with COVID definitely contributed. Being alone, which many people were, increases the risk of opiate overdose death, because if their person is using substances and overdoses, there's no one there to help them. In addition, during COVID, the access to treatment services for some people was impacted negatively. For example, at Spectrum Health, and as most of the agencies, we immediately jumped into a telehealth mode when everything shut down, but some people did not have access to those resources, so they couldn't utilize telehealth, and for some people, it's just that face-to-face is more important anyhow. So those are some of the things that we've seen.
Yeah, that cry for help is always out there, and you're trying to address that as best as you can.
Absolutely.
Yeah, and COVID really pulled a lot of negative forces together.
Sure
the
did.
unfortunate. Emma, let's jump over to you. Can you help our viewers understand addiction and substance abuse a little bit better? Like, for instance, people may immediately think that substance abuse and addiction is rooted in poor personal choices, but is there more to consider? And can you explain addiction in terms of what you've learned through your background in harm reduction?
Yeah, absolutely. That's a terrific question. I think I'll start out by pointing out that throughout the course of time, our society has viewed people who use drugs and drugs in general in a variety of different ways. And those ways haven't always been helpful. One example might be the moral model of viewing people who use drugs. That has to do with thinking that people who use drugs are product of a moral failure, okay? Fortunately, most of our society has moved a little bit away from that model. Another example would be the punitive model of thinking about people who are struggling with substance use or mental health issues. And that has to do with us assuming that people who use drugs are products of a criminal mind, and therefore they have to be punished and in some cases locked away. I think at this point in time, fortunately, we are embracing the notion that people use drugs as a result of a variety of biological, psychological, and social or systemic factors. That's called the biopsychosocial model for us in the social work field. It's also referred to as basic public health. So I think we're moving in a promising direction right now in recognizing that in order to take care of people who are struggling with substance use, we've got to assess and then meet people where they're at with the variety of
meet them where they
aspects
are
for why they use in the first place. Yep.
And that kind of encapsulates it, right?
Harm reduction, really, when it comes down to it, is a public health model that's all about meeting people where they're at. Yes.
That's awesome. That's good. That's a good thing. Brandy, I've got a question for you just regarding what you're seeing at Horizon Health and in the patient population specifically.
Sure. Well, when we're talking about opioid overdoses, I think that it's really important to also acknowledge that fentanyl in particular has contributed to the overdoses. And so what we're seeing with specifically people using opioids is that sometimes the overdose is so unintentional because they did not know that fentanyl was in their drugs. And we have people who their drug of choice is not opioids, they're using things like cocaine, and then fentanyl is laced in the cocaine and it's resulting in overdose deaths. So I haven't seen a big change in the actual populations coming in. What I would say is I'm seeing people coming in who are struggling with lots of issues, both mental health, medical, and substance abuse issues. So we have all of these things that we're working on. So we're seeing more complex patients with more acute issues that we have to address as a behavioral health and medical provider.
I hear that fentanyl is in, feels like it's in everything.
It is. We were saying essentially for a lot of our patients, we are providing things like fentanyl test strips so people can test the drugs that they are using, even if they're using things like cocaine, because we're trying to reduce the chances of them having a fatal overdose. But cocaine predominantly is a big one, and methamphetamines are the other drug that we're seeing a lot of fentanyl in.
What programs are you implementing?
So we do a continuum of substance abuse treatment. So at Horizon Health, we have everything from a residential detox model where people can come in a safe and supportive environment and be able to work with our medical professionals and our clinicians to be able to detox off of substances and then be put on medications that will help with cravings and urges. We have a rehabilitation model, which is a long-term program that people are in for upwards of 3 to 6 months. And we treat people in all different aspects of life. We have a women's program, we have a veterans and first responders program, we have a young adult program. And then in our outpatient programs, we are doing everything from intensified treatment, where people can come a few days a week, to drop-in model, where maybe they're not ready to potentially engage in treatment. So we're providing them with resources like Narcan kits, supportive clinical support, peer services, family education. And so we have a large continuum of care because patients come into treatment in all different stages.
So Ann and Emma, I understand Evergreen and Spectrum Health are working collaboratively with an enhanced medication-assisted treatment program. So Ann, what is the medicated assisted treatment all about? And Emma, how does this help?
Well, so what we do is, medication-assisted treatment it's not only medication for an opiate use disorder, like at Spectrum we offer Suboxone and Vivitrol, but it's treatment in combination with that counseling services. So we offer individual groups, we have peer services, things like that. Counseling helps a person learn new coping strategies, manage their emotions more effectively, deal with maybe trauma issues, things like that that could really get in the way of their recovery. And then the medication helps the brain stabilize and helps them manage cravings and withdrawal symptoms so they can focus on those other issues.
Does that reduce some of the problems that you see?
Yeah, absolutely. As Ann mentioned, buprenorphine, often referred to by its brand name, popular brand name Suboxone, and methadone, along with Vivitrol, a third medication, are really the gold standard for treating opioid use disorder. Scientifically proven medications to decrease the risk that someone's going to suffer a fatal or non-fatal overdose. I think that we're recognizing as behavioral health providers that medications have really changed the game for what we can offer people who are struggling with opioid use disorder. If it weren't for these medications, to be honest, I don't know, the statistics would be even more tragic and drastic than they are. And then when you, in combination with a tool known as Narcan, which of course has the ability, I know we've featured it on the show before, has the ability to reverse the effects of the opioid overdose. These are really tools that we want to get out into the community. And I think, what they do is they're medications that bind to someone's opioid receptors, and in doing so, can reduce cravings that someone has to use and reduce the incredibly severe withdrawal symptoms that come along with long-term fentanyl or long-term opioid use. And what we're seeing is we've got to accept that some folks are going to be on medication-assisted treatment for opioid use disorder for the rest of their lives, if that's what they and their providers feel is right for them. Some folks are going to need medication-assisted treatment for a short time and perhaps do what we might call taper off the medication in time. And some folks are going to, like a lot of medications, go in and out of using the medication. We've got to recognize it's whatever works for folks. We've got to get medications and Narcan into the hands of the community.
So meet them where they are. Use some of the latest medication that you've said is very successful. But what about attitudes toward treatment for substance abuse? Has it changed at all, Brandy?
Well, I've been working in specifically this field for about 20 years, and I will say that where I've seen the change is that we acknowledge that everyone can be impacted by substance use. More and more of our community has a family member, a friend, a loved one who has struggled with substance use and specifically probably opioid addiction. And so I think we have an approach that of a more of humanity and a little bit more humility around it. But we still have a lot of stigma that keeps people from asking.
That's why I was going to ask you, is there still that
absolutely
hovering over everyone?
We still have people who don't ask for help. We still have family members who shame people who are struggling. We have people who send people away to treatment programs, out of state and hope they can fix the problem. And so we definitely have a lot of stigma, but I have seen a lot of progress with just understanding that it impacts our community. It doesn't just impact specific individuals over there.
So there is success out there?
There's progress.
Progress.
And let's go back to the fentanyl, but before we get into that, the Narcan piece, we had done some public service announcements here on the station. That's very important, and I know the word is getting out to the community basically to, use Narcan. Is Narcan a substance that people can inhale? What is Narcan?
Narcan's a medication. The most popular way that Narcan's administered is like a nasal spray,
Yes.
a very small dose of a nasal spray. We recommend, I think, in the field these days, it's best practice to have all types of people in the community trained in how to use Narcan. It's very simple.
Yeah, get to know it. And, we talked a little bit about fentanyl. As we said, it seems to be in everything. How really significant is that? If somebody's out there and they're using and they are in denial that, my drug isn't laced with fentanyl.
You never know,
Can't be
right?
diluted into that.
Yeah, you can't really emphasize enough how it's fentanyl and its prevalence in Western New York.
What does it do to you?
Driving the overdose crisis. Fentanyl is a synthetically made, extremely strong opioid that we saw really become increasingly prevalent around 2015 in Western New York. And 2015, 2016 marked a real rise in overdose deaths due to fentanyl when medical examiners' offices looked at, unfortunately, the bodies of individuals who had suffered a fatal overdose. They started to find 75, 100% of those individuals had fentanyl in their system.
Is there a certain age group that they're finding that increase in the deaths?
That's a great question. It's across the board. I do think that the data that I saw in 2016 and 2017 in that era portrayed a young demographic really struggling with fatal overdose. Right now, there are higher age groups included in the mortality data, which is concerning. And we're also seeing communities of color represented in that overdose fatality data in a way that is increasing. And so those are just, those are really concerning patterns to be noticing.
I think
very troubling.
Go ahead, Brandy.
I just wanted to point out for the general public, when you think of fentanyl, it's 100 times more potent than morphine. And so I don't think that people realize the significance of how addicting it is, but that we have people who are intentionally putting it into drugs because it's cheap and it's addicting. And so it can take a little teeny piece to have someone be using or unintentionally use to result in overdose.
It sounds so evil to me.
It reminds me sometimes of when growing up, you used to hear if you tried heroin, you were like hooked just like that. Does it sort of have that same impact?
It could. It depends on the person. So the thing about addiction is that for some of us, we can take different pain medications and never develop a substance use disorder. For some people, their brain is conditioned and they might, the first time they use, first few times they use, really develop that addiction. It can recondition your brain chemistry. The issue with fentanyl is that it's highly addicting and people are often chasing that high. And unfortunately, when they continue to chase that high, that risk of overdose increases over and over again.
We only have about 10 or 15 minutes left. And I want to just jump real in. How do you know when somebody has the warning sign of addiction?
Yeah, it's hard to know.
Well, most family and friends do kind of know that a person is using substances. What surprises them seems to be the extent of the substance use.
So you can cover that up?
Yeah, you can cover it up for a while. But what I think what people would be looking for would be any unexplained changes in behavior, appearance, things like, and then missing family events, not showing up for things, maybe having money problems,
I've run into a couple of people that have always a need of money.
Yeah, maybe.
And they have great, interesting ideas. It has nothing to do with,
Yeah, maybe.
Maybe,
Everyone,
you never know.
Yeah, you never know. But, behavior changes. And then I think, as Brandy said earlier, sometimes people want to just ship their family off to get fixed somewhere. But I think when you notice those things, approach the person not in a policing type way. You know, I noticed
Have
this.
compassion as well.
Yeah, I noticed this about what's going on. Is something going on? Can I help you?
Yeah. Emma, I'm kind of curious. We talked about it briefly about harm reduction. Could you kind of explain what harm reduction is, that approach?
Sure. Harm reduction is a method for providing services to people who use drugs in a way that focuses on reducing harm associated with using. So actually we talked a little bit about Narcan. Narcan's probably the most popular or well-known example of a harm reduction intervention. When we're giving the community Narcan, you know, we're training people to respond to opioid overdoses. And when we're making sure that people who use drugs have Narcan on them, we're letting folks know, I see you, we want you to be here, we want your peers to be here, carry Narcan with you, and you can talk to us about what's going on in your lives. So it's a real practical tool. It's kind of why it's a good example of harm reduction. It's giving people the means to take care of themselves in a real practical way, but it's also building trust and rapport and breaking down that stigma and letting folks know you have some non-judgmental people that you can talk to about what you're struggling with.
And I just have a question regarding parents and teachers and mentors. How do we get them to talk about this to their kids?
Well, they absolutely should talk about this to their kids. And I think that there's no specific age limit where you would say, okay, when you're 10, we can talk to you about it. I think you would talk to your kids when something's going on, when, you know, whether it's in your home, your family members, their friends, parents, community, and just talk about what's going on so that they do know that this is related to substance use. I know the schools do it too. I know that one of the local Buffalo schools, I have a friend who's a teacher, and she said, I think next week is Blue Ribbon Week, and they're going to be talking about things like, they're going to have talking circles and talk about things like drug use to the kids so that, you know, everyone's aware.
Starting early is a good idea.
Yeah, and it doesn't promote drug use to educate people. You know, it helps them make better choices.
Yeah, we work with an organization called Prevention Focus, if you know Matt Smith, and they go into schools and do that early intervention. It's amazing
Great
stuff,
idea.
and we help them. Emma, I wanted to talk to you, or I'm sorry, Brandy wanted to talk to you. If addiction is self-harming behavior, which we talked about, what are some of the other behaviors that would harm somebody in addition to using?
So a lot of times we talk to our patients, we talk about addiction being a maladaptive coping skill. It's something that they're doing because sometimes they're struggling with emotions, stress, perhaps, you know, different relationship, financial issues, whatever it may be. But a lot of times when we start talking with patients, they actually have a lot of unhealthy coping skills. It could be things like engaging in high-risk relationships, unhealthy relationships, cutting behaviors, isolating and really not socializing. So we really want to make sure we're assessing all of their maladaptive, unhealthy coping skills and trying to provide them with resources and skills to live a healthy life. And so those are things that we do in therapy in conjunction with the medications that we talked about as well, really teaching them how to cope with life on life's terms in a healthy way.
We have just about 2 or 3 minutes left, and you touched on something in the communities of color. Is there a difference, you know, with not only communities of color versus a more affluent community versus, you know, what are the changes, men and women? Are there?
You're probably trying to find out, is there something that's specific because of disparities
Does
of
it
health?
It just cut across every line?
It cuts across, yeah. I think in pointing out those statistics, thanks for letting me clarify. I just wanted to make note of a pattern of increases in fatal overdoses in certain communities, but this is an issue that unequivocally cuts across all demographics.
Interesting to know. So everybody, and it doesn't matter where you are in your lot in life. If you become an addict, then you really need that help. You really need to, and you need to reach out. All right, well, we're out of time, Sandy, for this edition of our community
But it's
conversation.
okay to say, I need help.
It is okay, and that stigma, I think Brandy brought up, you can't have that stigma in asking for help, no matter what it is, whether it's addiction or mental health
I'm so
issues.
glad you're here and you're able to help those that probably are watching right now and are struggling. And so to know that they're here in Western New York and operating and helping and bridging that gap, it's a good thing.
So we want to thank and Bowback from Spectrum Health, Emma Fabian from Evergreen Health, and Brandy Vandermark-Murray from Horizon Health for being here today. They have some important websites that are important to write down if you need help, and all of this information is going to be on Buffalo Healthy Living magazine as well. Let's start with Evergreen Health. They're at www.evergreenhs.org. Horizon Health is at www.horizon-health.org.
Spectrum Health and Human Services at www.shswny.org. Office of Addiction Services and Supports at oasas.ny.gov.
Western New York Opioid Addiction Treatment Hotline Matters Network.org. And the Erie County Department of Health Substance Use, Help and Resources at www.erie.gov/health.
Yeah.
Make sure you also check with your medical provider and those trusted source in your family and in your world to get some help.
We care, they care, so please reach out if you need the help. We will be continuing these important community conversations on WBBZ, produced in partnership with Annette Pender and Buffalo Healthy Living magazine. Be inspired to make change, be inspired to have conversations with one another. And thank you for watching.
Thank you. This special edition of your Hometown Health Connection Community Conversations, Heal, Talk, Act, was presented by Buffalo Healthy Living magazine with support from the Buffalo Federation of Neighborhood Centers, Karamia Pet Resort, Circuit Clinical, Endeavor Health Services, Medical Society of the County of Erie, the National Federation for Just Communities, People Incorporated, Community Services for Everyone, Horizon Health Services, Spectrum Health and Human Services, Best Self Behavioral Health, and WBBZ-TV.
Hi, I'm Frank Scarpinato with Erie County Department of Health, and today I'm going to show you naloxone. There's two varieties here. The first is an intramuscular, injected with the use of a needle. We recommend that you avoid these because of risk of getting stuck with a needle. The other is the intranasal. There's two varieties. There's the simplest one. In this unit, you just take out of the package, and then you stick this up their nose, and you just give it a little spray. That's all you need to do. The other unit, the unit that we issue to our law enforcement and at our trainings, it comes of three pieces. You have your syringe, you have your atomizer, which screws right onto the front, and then you have the medicine. You would store it like this until you need to use it. When you need to use it, you take the purple cap off, screw it right into the back, stick this up the nose, and then spray half up one side, half up the other. Wait 3 to 5 minutes and administer the second dose. In all of these situations though, call 911 first. Thank you.
Buffalo Healthy Living magazine is a free, full-color magazine distributed throughout Western New York. Now, more than ever, as we all want our families and friends to be safe and well, Buffalo Healthy Living magazine is devoted to health, fitness, and nutrition for people of all ages. It's a great read and also has great recipes. Pick up Buffalo Healthy Living magazine all over our hometown or go online anytime at buffalohealthyliving.com.